How's it going, guys and gals? I hope everyone is doing good. So today's video, I wanted to talk about the eventual COVID-19 vaccine because it is right around the corner and it will come out whether you like it or not. Obviously, a lot of people are going to want to take it because they are scared, especially from the media, and they're terrified, so why not get a vaccine? But I wanted to disclose and talk about and discuss some of the information that I've researched. So the company, it's called Moderna. Moderna, Moderna. They are a biotech company, and they are the front runners. I think there were like 3 or 4 companies that were trying to scramble and get this COVID-19 vaccine out. Nonetheless, Moderna, they are the front runners, and they got about $500 million funded from the government to get this thing rolled out as quickly as possible, and to get it out as quickly as possible while the fear is still present in the United States, and not only United States but in the entire world. And you need customers, and fear drives people to take vaccines. Anyway, this company Moderna, after doing a little bit more research, they are, I should say, it's a little sketchy. Moderna to date, and correct me if I'm wrong, they don't really have much of a history. I think they've only been around for about a decade, and they don't, to date, they don't even have any scientifically backed up or peer reviewed vaccines on the market. They're very secretive. It's hard to find a lot of information, and to me, past results and past performance usually is a good indicator for future performance. I think I messed that up a little bit. That I think that's the saying, right? Past results will, give you a good prediction, a predictor of future results. But they don't really have anything, So why is the government giving them 500 million? Well, they are. I can only speculate, but when when someone gives you $500 million, you're going to take it whether the vaccine is safe or not. So to talk about the actual vaccine, um, they're trying to implement, and they will implement. It's called RNA technology, and this is not your ordinary vaccine. Okay, this is not your ordinary flu shot. This is, I don't know how much they're going to delve and go into detail. They may just try to brush it under the rug and market it as the next best thing to make sure you don't die from the COVID-19. Anyways, with RNA technology, what happens, I'll try to put this in the most simplest terms, they basically inject the RNA, the protein, into your body, into your cells, and then once it's in your cell, your body actually internally produces the vaccine internally. So your body becomes supposedly this, you know, viral fighting machine from within, as opposed to the standard vaccine, which is an external vaccine, and then they inject you. I'm not 100% sure, but some people have stated that it actually will permanently change your DNA, and this is kind of concerning, especially if you plan on having kids. Now, I can't confirm this yet. I don't 100% know. If anyone in the comment section can confirm this, go ahead, but I'll probably still be doing more research. But that sounds a little bit scary. And the other thing is that a lot of pharmaceutical companies in the past, these reputable pharmaceutical companies, have shied away from trying to implement RNA technology. Why? Because it's very risky, it's very complicated, it's very hard, and the trials and the clinical trials that they have tried with the RNA technology with the vaccine, it's been, I should put it this way, shaky at best. Tremendous amount of risk and a lot of side effects. Yet the government wants to roll this out quickly and fund $500 million to a company that doesn't even really have uh, a good track record. They don't even have a good track record. That is absolutely scary. So, like I said, I don't know. It's still early right now. I don't know how much they're going to delve into that. But if it does change your DNA, they're not going to go out and say it. That's for sure. That's going to scare the crap out of people. So Moderna, very suspect company. They're very secretive, a poor track record in their past, yet they're getting $500 million because they can they can get it out as quickly as possible. It's almost like instead of trying to find the best company, maybe to slow down and pump the brakes, the government just wants to rush. And I know goddamn very well that Anthony Fauci and then the CDC and the WHO and all the politicians, they're probably, maybe they're stupid, maybe they'll take it, but they're not going to be a test dummy. Bill Gates is not going to take it. That's for sure. So I would not take it. I 100% would not take it. Now I work in the hospital. I don't know if eventually it's going to get to a point where they make it mandatory. If I ever have to encounter that problem, I will deal with it at that time. I've been thinking about it. I'm not sure, it's a little bit tricky, but the majority of you people watching my channel are not working in the hospital, so consider yourself lucky. And I 100% would not take it. That's just my 2 cents. I'm warning you about it. I think that's all I pretty much have to say. Your best response to fighting viruses, bacterias, common cold, all that is to just to eat right, try to eat clean, exercise, get good sleep. You know, the basic things. You don't want to pump stuff into your body. Now, I'm not 100% anti-vax, I'm saying, but with this vaccine, and real quick, I want to say is you don't want to be the test dummy, because what happens is kind of like a phone, right? When the new iPhone comes out, or a Samsung. I think that one Samsung, like caught on fire, right? Anytime you get a new iPhone, the new version, everyone hops on. They want to get the first iPhone, the next version, the next operating system, and then what happens? Like years ago, happens all the time. That glitch, and then they fine tune everything, and then the next version's a little bit better. Now with the phone, you could just toss it, right? But do you want to? Can you fine tune your body? You want them to use your body as an experiment. Oh, we had side effects. Well, I don't know. And these pharmaceutical companies, they're often highly protected since the late 1980s. They've been protected by the government because they were about to go out of business, and the government decided to protect them. But that's it. That's my time. That's what to expect with the COVID-19 vaccine. I'll let you know if there's any new findings that I come across, any revelations, and knowledge is power. Just remember that. Talk to you later. Bye.